Understanding hemophilia can help mothers and healthcare providers plan for a safe pregnancy and delivery. To start, let's look at what hemophilia is. Hemophilia A is an inherited bleeding disorder caused by low levels of factor VIII, a protein which helps blood clot. When factor VIII levels are low, clots are fragile, and bleeding is harder to control. Hemophilia is caused by a change in DNA, the molecule inside cells that contains instructions for our bodies. A DNA change that causes disease can also be called a genotype. Mothers with a hemophilia genotype and their affected babies can have excessive bleeding. Mothers can have many kinds of bleeding, including nosebleeds, easy bruising, joint bleeding, heavy periods, and bleeding with childbirth. During a normal pregnancy, the uterus and its blood vessels expand to help deliver nutrients to the baby and remove waste through the placenta. After birth, the uterus contracts to squeeze out blood and close blood vessels, stopping bleeding. When there is too much bleeding, it is called postpartum hemorrhage. The most common reason for bleeding with childbirth is the uterus not contracting enough. A few other reasons for postpartum hemorrhage are injury to the genitals, retained tissues in the uterus, or impaired blood clotting. Mothers who have a hemophilia genotype are at higher risk for heavy bleeding with childbirth. Bleeding can start with delivery and continue for weeks after birth. Treatments are available to reduce bleeding from childbirth. For mothers with a hemophilia genotype, each male child has a 50% chance to inherit hemophilia. There is also a 50% chance each female child will inherit a risk for bleeding and hemophilia. Females can bleed even when factor VIII levels are normal. Babies who have hemophilia are at risk of bleeding during or after birth. A rare but serious bleeding complication is bleeding in the brain. Other bleeding can occur from procedures like circumcision or blood draws. To create a birth plan, it's important to begin early and choose the right healthcare team and delivery location. It's important to make the birth plan together and to gather information, including testing the mother's genotype and factor VIII level, understanding the mother's bleeding, family history, assessing other postpartum hemorrhage risks, planning method of delivery, determining fetal sex, and considering prenatal genetic testing to see if the baby inherited the genotype. With careful planning, pregnancy can be managed to reduce bleeding risks for both the mother and the baby. Learn more at harpf8.org/resources.